Hi guys, welcome back to the channel. So we have started with the treatment and management plan. We have dealt in brief about the management of mandible ameloblastoma and maxillary ameloblastoma depending upon the extent of the tumor and location of the tumor. Then we have dealt with the conservative treatment. We have started little bit about the radical or curative treatment rather than surgical treatment. Now we'll be dealing some of the things in detail about the surgical treatment of ameloblastoma in mandible. Okay, let's start today's class. Okay, we are using a transoral procedure or transoral approach. So bony resection is done in a box like fashion with right angle corners. Okay, it is done. See, the bony resection is done in a box like fashion. Okay, it should be in a box like fashion. Okay, avoid in case of more than 30 years, and if there is remaining inferior border is less than 1 centimeter, so we should avoid that. Okay, box like fashion. Now why? Because reduced elasticity of the bone in this age group coupled with biting forces that are transmitted to the right angle corners of the box result in pathological fracture. Okay, what happened? Due to the reduced elasticity of bone in this year, as in more than 30 or 50 years of age, coupled with the biting force that are transmitted to the right angle corners. Okay, if we are making a box shaped thing, then there is a right angle corners, so the biting force is transmitted to that, and it will result in pathological fracture like this. It will result in pathological fracture. Okay, so to reduce this, a curvilinear motion or U-shaped resection to be done with wider top. Okay, to reduce this pathological fracture, rather than a box-shaped incision with a right angle corner, we give a curvilinear incision or a U-shaped incision. Okay, which appears superior design appears like this. Okay, it creates a slope or a arch. ठीक है, this is all for peripheral resection. So to reduce this as in to reduce pathological fracture due to the right angles of the box shape pattern in old age people, or in which there is the border is less than inferior border is less than 1 centimeter, we give a curvilinear motion or U-shaped resection to be done with wider top. Okay, it is closed primarily. Lost bone height is regained by osteogenesis in young patient. Okay, in young patient osteogenesis से जो भी bone height है वो regain हो जाएगी. Immediate bony reconstruction is possible and reduce infection potential. We can do immediate reconstruction, so infection potential is also reduced. Okay, we can use recombinant human bone morphogenic protein, that is RHBMP. Okay, we can use recombinant human bone morphogenic protein. Okay, other things we can also use, we'll deal with that in last class. I'll let you know what all extra things we can use other than grafts. Okay, so recombinant human bone morphogenic protein to a cellular collagen sponge, that is RHBMP 2/ACS, a cellular collagen sponge. Okay, a cellular collagen sponge. Okay, this is RHBMP2, a cellular collagen sponge. RH is recombinant human, BMP is bone morphogenic protein. So this is written as RHBMP2/ACS. That is acellular collagen sponge. Okay, it shows alternative for autogenous grafting. Obviously it is for if we are not giving grafts, so we can use this. Okay, this is the new thing. Crush cancellous freeze dries allogenic bone plus PRP will regenerate bone. Okay, we can give cancellous freeze dried allogenic bone plus PRP, which will also help in regeneration of bone. Okay, this is one way of doing the tumor if it is present in the anterior border, mostly anterior or mid anterior border. Okay, that's all for today. Now next class will be dealing how to deal with the posterior thing in mandible. Okay, till then, like, share, subscribe and comment. Bye.